Maternal mortality in the United States is rising, and the CDC says more than 80% of these deaths are preventable. The warning signs sit scattered across labs, medications, and life circumstances no single doctor ever sees together. MaternalGuard closes that gap. Meet Maria, 28, 32 weeks pregnant, Spanish speaking, on public insurance, with a prior preterm delivery and food and transportation barriers. Her next visit is tomorrow. This is the prenatal visit prep agent. 5 custom tools, reads Maria's chart, and a vector library of real WHO, CDC, and ACOG guidelines grounds every answer, one prompt. Prep me for tomorrow. Here's what generative AI does that rule based software cannot. Her blood pressure is rising, AST is climbing, platelets are dropping, uric acid is elevated. Each value alone is unremarkable. Together, at 32 weeks, they're early signs of help. A life threatening form of preeclampsia, a threshold alert would not catch this. The AI does because it reasons over the trends, the pregnancy specific reference ranges, and the actual guidelines all at once. And every risk it surfaces cites the source guideline by name. Now look at the recommendation. Maria is allergic to penicillin, and the standard antibiotic given before delivery to protect her newborn is penicillin based. The agent catches it and recommends a safe alternative citing the specific national guideline. It also ties her language barrier to interpreter supported counseling and her transportation gap to a lower hospital admission threshold. A lab value, a social barrier, and a medication choice connected in one chain of reasoning with sources attached. On-call OB triage has no tools of its own. It delegates over A2A to the specific specialist agent. Imagine Maria calls the on-call line tonight with a severe headache and blurry vision. The triage agent forwards the case. The specialist reruns the same tools and the same guidelines search. The answer comes back in seconds. Send her to labor and delivery now. Here's why, and here's a Spanish summary she can read herself. This can run inside a real health system today. FHIR access is read only. No patient data appears in any server log. The endpoint requires an API key. Every recommendation cites a guideline by name, and a guardrail enforces clinician review required before any action, before any response reaches a doctor. Earlier recognition of preventable signals means fewer maternal complications and shorter newborn intensive care stays, saving lives and tens of thousands of dollars per case. Deployed today on the Prompt Opinion Marketplace, that's MaternalGuard.